Hey guys, Dr. Ray Marque here, your local chiropractor at Back Pain Relief Center, coming to you from Murrells Inlet. Also want to say hi to all my South Jersey friends, family, and patients up there, anyone watching this. Today I wanted to talk a little bit about chronic pain and what kind of things we can do to help people function and feel better, and how you kind of get there and things like that. And I'm seeing it more and more, people that have these disorders with their neck and back, and they just become this huge problem in their lives, and no one really gives them a good answer on what to do, and kind of get swept under the rug unless you have surgery. There really kind of is no good answer, at least from what I'm seeing. And I came up with this topic because I had a patient, I think it was last week, that had a back problem or a sacrum and pelvic problem, which is all kind of related. And we had difficulty treating her because of her pain levels were so high. So I'll kind of get to that particular case in a second. So number one, for chronic pain, people that are in pain, I'm mainly talking, at least talking now, about neck and back problems, because there's a lot of different types of chronic pain. There can be some neurological disorders out there that are just really tough to beat, and ongoing medical treatment is most likely more appropriate for them. Same thing with some systemic problems, like, diabetes can cause a bunch of problems. Some arthropathies like rheumatoid can cause quite a bit of problems and some pain, and they need to be managed, medically. And I guess really all of chronic pain needs to be managed medically, but there are some types that chiropractic can have a huge success rate with. And I'm talking more biomechanical stuff. So what I mean by that, and let's just talk about our low back, but really has the same meaning when we talk about our neck. So say you have some herniated disc in your low back, and your low back has degenerated, or you have degenerative joint disease. For whatever reason, one reason or the other, your back has degenerated so much that we have an awful lot of dysfunction in that joint, meaning the disc is probably herniated, maybe it's extruded, maybe it's pinching right on a nerve, maybe you have some facet arthropathy or some facet problems, the muscles are tight, radiating pain, things like that. And it happens for all kinds of reasons. It happens from not being treated properly, it happens because of genetics, it happens for a whole host of reasons. Is what it is though, it just kind of, you get in that position and that's where you're at. So what I see more and more these days, you have patients with these back problems, and they've tried all kind of medical routes. So they've tried injections, they've tried medication, they've tried physical therapy, they're trying all these things, and nothing kind of gives them that relief that they're looking for. Then the doctors start talking about surgery, and then there's a whole host of reasons why people don't want to get surgery. And even a lot of the surgeries, they do what they say they're going to do, but in the big picture of the back disorder or problem, it still doesn't really cover it up or fix it up. So you can have a back surgery and really still feel back pain after. So I think we've all heard good and bad stories about it. So again, I'm going back, I'm talking about mechanical pain or dysfunction, the joint's not working right. So I want to first say that everybody has room to improve. I don't care how bad your back is degenerated or how bad the problem is, everyone can improve. And I mean that on a biomechanical standpoint. Range of motion can improve, decreased tone can improve, flexibility can improve, more motion helps. Now, will it make you 100%? Probably not. 25% better may be good though. And the way that, at least I have a lot of success with that, is spinal manipulative therapy, so adjusting your back, and some myofascial work, stretching the muscles out, loosening everything up, decompressing the joints, increasing range of motion. And many times that, in conjunction with appropriate medical care, the patient begins to feel better. Again, the fix it, feeling 100% ship may have sailed, but if we can get you 50% better, 60% better, or if we can make your bad times less bad and less long and less intense, I think that's a win. So in short, you kind of find out what works for you. Don't be afraid to try spinal manipulative therapy or chiropractic, or don't be afraid to try physical therapy, even if it didn't work at once. I think, you know, we've all been to physicians that maybe for whatever reason in that particular day, that treatment didn't work well for us. Doesn't mean that all the treatments won't work well. And I think that even goes for injections. When we send people out for lumbar epidurals, sometimes they work, sometimes they don't work. And I don't know why. That's a better question for the pain doctors, but there's all kind of reasons. So let's get back to that case of the patient I was talking about and the reason why I wanted to start this whole talk. She came in with sacroiliac pain, and that pain was pretty severe for her. And she had shots in the past, meaning SI joint injections, she has lumbar epidural injections, taking oral medication, doing all this stuff, and this pain still didn't go away. My approach was to loosen all the muscles around that joint, decompress the lumbar joint, give her some more flexibility, and see if that begins to take pressure off. Here's a problem though. The actual care that we did, she was having a difficult time going through it, meaning she was splinting and guarding. And what that means is when you're in so much pain and we move a certain part of the body kind of seizes up or locks up or spasms and doesn't allow us to get the degree of motion or flexibility that we wanted. And sometimes it's because of pain, sometimes it's because of a learned response, sometimes it's because it's an automatic response. Your body just won't allow us to get in there. And the patient was a little sore after, and we haven't seen her since. So we talked to her on the phone, and she's like, well, look, I'm going to try some injections first before I decide to do the physical part of it. And I think that's a good plan, because remember, it's your body, and you do what you would like to do. If that's the route you want to go, I'm all for it. But I still believe that that kind of patient we can help. So if you've ever been to a doctor or a chiropractor or a physiotherapist or anything along those lines, and you're like, hey, that made me worse, that was more painful. Well, it may be in the beginning. The hard part is that we have to touch the bad spots. We have to stretch the bad spots. We have to push on the painful spots in order to loosen them up. Sometimes it's a necessary evil to get through this, to get that function back to it. That's why it works great in conjunction with some medicine from your pain doctor or whoever's working with you at that level. So on, I guess the big picture of what I'm trying to get here today, if you're suffering from chronic back or neck pain, give chiropractic a chance. Don't let the soreness stop you from continuing to get care, and give it time to get through that. That's why here at Back Pain Relief Center, we always, if we're dealing with a chronic condition, I'm going to get you to the appropriate medical doctors, let them know what I'm doing in conjunction with what they would be doing and what our goals are, and hopefully we get you to a better spot. There is an additional thing that I do on my end. Sometimes when you've had these chronic conditions for so long, you build up scar tissue and adhesions in the joints and in the muscles. Okay, and what that means is when muscles or joints rub abnormally too many times for extended periods of time, your body doesn't like it. It puts some collagen down in there to stop it from rubbing so much. So whether it's a shoulder joint, whether it's a back joint, or whether it's your muscles rubbing, it builds up these adhesions and it makes tight muscles and tight joints. And there's so much adhesive buildup that trying to break it up while you're awake or while you're in the office is half impossible sometimes. So I specialize in a procedure called manipulation under anesthesia. And what we do with a manipulation under anesthesia is we put our patients to sleep through light sedation in a surgical setting. So meaning you'd have to go to a surgical center, they hook the IV up and all that, you'd see a medical anesthesiologist, they'd get you all set up, we'd put you to sleep for about 20 minutes, and I would go in there and we would put your body or put your joints through very aggressive ranges of motion to break up the scar tissue in the muscles and in the joints to restore function. And it's a great procedure for people that have very limited range of motion and very high pain levels. So it's like taking 12 visits when you're awake at an office in a traditional setting and bunching them up all into one. I've done hundreds of these procedures. I'm going to say it has close to 95% success rate in returning range of motion. I've had patients with frozen shoulder syndrome that they couldn't even touch their head. After performing the procedure, we have full range of motion back on that arm. So again, manipulation under anesthesia works really well for the patient who thinks or feels, I don't want to say thinks, who is unable to have traditional therapy. It's the most aggressive form of physical therapy out there for the muscles and the joints to restore motion. So that's my little talk on chronic pain. If you're suffering from a chronic pain condition that really has you down and you're frustrated with the care you've been getting and you're not sure what to do, shoot me a message on Facebook. I respond to all of them. We'll talk about it a little bit. You can even give me your number. We'll talk on the phone and see if we can't do something to make you feel better. All right. If you want to learn more about everything that we do here at Back Pain Relief Center, just go to murrellsinletchiropractic.com, or you could always Google Back Pain Relief Center, Murrells Inlet, and you can find us. I hope all is well. Everyone down here in South Carolina, enjoy that beautiful day out there, and we'll talk to you soon. Bye-bye.